My dad's too young for Medicare, okay, but he's not eligible for Medicaid, and he's on early retirement Social Security, so he's lower income. He needs an expensive medical procedure. Is he supposed to give up the rest of his assets or his life? He's unable to get on the waiting list for Badger Care. When is health care reform really going to come for someone like him, or is he supposed to hold his breath till 2014?
This is exactly why it was necessary to pass this health care bill. Your dad, you said under 65?
Yes.
But over 50?
62.
Okay. This is the most vulnerable group of Americans in the situation that existed prior to passing the health care bill. This is why there was some talk about, as we were negotiating, bringing the Medicare age down to 55. It's because these folks are often at the end of their employment period, and if they get sick, they're in a very tough spot in terms of getting covered. This bill has immediate provisions that are dedicated to try to help somebody like your father to get the funding they need, to get the health insurance they need in the interim before we set up these exchanges. These exchanges would guarantee somebody like your father the ability to buy insurance, and it says that if you can't afford it, you could get government help so that you don't pay more than 9% of the insurance, or more than 9% of your income for the insurance. So this bill is precisely targeted at this kind of person. And I heard many horror stories at the town meetings from people who said this is what was happening to them. So, you know, one of our candidates for governor says help is on the way. Help has already been enacted here. My opponent would repeal that. My opponent would repeal all of this. He would wipe it out. And that is a tragedy for Wisconsin and people like your father if we do.